You're here today because you're suffering from a disorder called Fordyce spots, or also known as Fordyce granules. They're small pimple-like structures that commonly form on the body. They're mostly seen on male and female genitalia, but it can also be found on the lips, inside the mouth, and around underneath the eyes. They're also confused sometimes as melia or Syringoma, and I do have tutorials that will describe those disorders. Today I will be describing different methods, both natural and medical, that you can make a decision if you want to proceed with medical procedures or natural remedies. Fordyce spots appear when the glands near the lips or inside the mouth oversecrete the sebaceous glands, which is trapped sebum underneath the skin. The glands swell up with oil or like white substance, some people call it pus, and cause a white spots to appear on your lips or mouth. The good news is that they are entirely normal, are not contagious, and they are not related to any cancers. Now, popping them or squeezing them, the bumps will not cause them to go away, and they will only irritate them. If this is your first time on my channel, my name is Maria and welcome to Aglaya Aesthetics Online. Give me comments below, and if you disagree with me, please do it respectfully. And if you have not subscribed to my channel, please consider it. Click on the notification bell so you will not miss any of my educational tutorials. How do you get rid of these granules or spots naturally? There are several home remedies that I'm going to list today that can be used effectively to treat these white spots on the lips, on the eyes, and different areas of the body. And you decide which one works for you by a combination of several of them, or you might find that some of them are better for you than others. So the first one is to strengthen your immune system, and by taking vitamins. Plenty of vitamins daily helps treating these spots. Your daily diet should include several vitamins, including vitamin D, E, A, K, C, and vitamin B. These vitamins will help you treat spots and other health conditions as well. Source of vitamin includes your fruits and vegetables, your cod liver oil, whole grains, cereals, and fish. Essential oils, that's number 2, are widely used to treat various conditions and diseases, including the Fordyce spots on your lips. The best essential oil to use is jojoba oil, which prevents the development of these spots. And you can also use olive oil, tea tree oil in combination. Now, jojoba oil and argan oil are rich in vitamin E, and vitamin E is effective against various diseases, infections, or skin conditions. Now, the next one is garlic. Now, you can take garlic by doing garlic water, and I have a tutorial on that. For me, it's very difficult to just drink garlic water. I just don't like the taste of it. However, I do intake a lot of garlic in my cooking because garlic is an amazing antioxidant and anti-inflammatory, and just add it daily in your diet. I have my little dog here, and he is amazing. His name is Mr.Blue. Apple cider vinegar. You know that I am pro apple cider vinegar. Is one of the most effective remedy to treat Fordyce spots. Apply a solution of apple cider vinegar and water mixed in equal parts and apply onto the spot. It will kill the harmful bacteria present in the area. Wash it off after a little while. It could be 30 minutes and an hour, and do it several times a day. The astringent and antibacterial property ensure the bacteria are eliminated and a balance required in sebum secretion is achieved. As you know, with apple cider vinegar, there is so many things that it will help to prevent a balance the skin. Asparagus is essential to normal growth of body cells. It has the highest concentration of folic acid, which is required for cell production. A cup of this vegetable gives you 65% of the required amount of folic acid every day. Asparagus is rich in vitamin K, A, and C, which helps in eliminating these Fordyce spots. So, when you get these things on your lips, it is something happening in your body. So you will need to strengthen your immune system, reduce the oxidative stress caused by free radical damage. And one of the things I encourage is the NRF2, and the information is down below. Citrus fruits are high and rich in folate acid. Raspberry has 4%, oranges 10%, strawberries 6%, papaya 29%, and grapefruit 8%. Squeeze the juice of these fruit. You can use one or two or several of them. Mix it in a small amount in water and apply the solution on the spots. The Fordyce spots on the lips will disappear, will reduce gradually. But again, everything needs to be taken in consistency and also persistency. So you will have to figure out which will work for you internally and as your diet, and also externally. Broccoli has high level of vitamin C. Include broccoli in your diet. It provides you with 149% of the recommended daily intake of vitamin C. Oranges gives you 89%, to give you an idea of the required vitamin C intake. You can include broccolis as in your salad. You can gently steam them, apply a little bit of olive oil. Fordyce spots can appear on your lips because of dehydration. So using coconut oil as a natural moisturizer, that will be very effective in reducing these spots. You can apply the coconut oil directly in the affected area in conjunction with essential oils like lavender. You can use olive oil as an alternative to coconut oil. If you use a combination of these remedies, you can use one or two or several of them, you will notice that slowly they will minimize and they will reduce. You might like apple cider vinegar, or you might enjoy the coconut oil. So figure out which one is best for you. So let's look at the medical side for these granules. Fordyce spots on your skin or your genitalia areas are harmless. You don't need to treat them. Sometimes people confuse them for genitalia warts or other problems. So it is important that if you are concerned, that you're going to go to your doctor, and he or she will examine them and it will tell you what they could be. Some people find that these spots are bothersome or unsightly, and if you are affected by these spots, your doctor might offer you some of these treatments. So one of them is the carbon dioxide laser. Your doctor might suggest this to remove these spots with this procedure. These can leave scars though. The pulse dye laser might be a better option for you. Retinoid medication might help you with a combination with laser treatments. These pills, however, cannot be taken for long periods of time. Some topical creams, acids, topical treatments can shrink or even remove these Fordyce spots. These work together good with laser treatments. Photodynamic therapy, yes, could work, but the side effects could be post-inflammatory, hyperpigmentation, that means darker spots, burning sensation, and sometimes blistering. Another treatment is the micro punch technique. This treatment is a minor procedure that will remove the Fordyce spots along with some underlining tissue, so it will leave like a little holes. This is a technique done by a doctor with a pen-like instrument, and of course some local freezing. Electrologists might use the procedure of electrocoagulation. This procedure is using a little microneedle or a small probe. It's inserted in the area. It's like a little mild electrical current, and it will coagulate the area. Generally, Fordyce spots are harmless and do not need to be removed. It's usually best to leave them alone unless they're affecting your self-esteem and confidence. I hope you found this video to be useful and walk away with simple and easy tips that will make your life easier, that will reduce your Fordyce spots with natural remedies. Remember to treat yourself always with the utmost respect. Until the next time, take care. We are in Victoria, which is the capital of British Columbia, and we are going to go for a nice little walk. Okay, so we are all dressed up properly. Hey, Mr. Blue. Mr. Blue, are we ready to go? Yes, we are. That is the path that we are going to take, and it will take us to the center, and that is the Empress.